It's a challenge when you're trying to navigate the initial policies that come through for these kind of medications. I can give you some practical examples. So you gave age as one of your criteria, and I think as an SMA specialist, I would say I don't understand that arbitrary line, because if you're talking about somebody who's just starting to have symptoms of SMA when they're adult, the FDA says that this medication can benefit anybody with SMA based on the data that was presented to them for the trial. So why are you not giving access to this treatment to an adult living with SMA?
I was going to ask that.
Yeah, there doesn't seem to be any data-based reason why that should occur, versus somebody who was very severe with their initial presentation, may even be symptomatic at birth, would be less than that age, but there might be another argument for why the therapy might not be as efficacious if someone's lost a lot of motor neurons already with this disorder, and you're trying to save what's left or give some other aspects of how SMN deficiency is affecting the patient is what you're trying to rescue with the treatment. Another thing that we came into early on was that in the research trial, the SMN2 copy number was actually one of the inclusion criteria for the pivotal trials, the ENDEAR study, the CHERISH study. And so a lot of the payers initially were saying we will only cover people with a certain number of SMN2 copies. But in our clinics, we sometimes don't even test the SMN2 copy number for our patients, because once we know they have SMA with the SMN1 deletion, and we know when they started with symptoms, that really is irrelevant for the patient. And any person living with SMA has to have SMN2, because if you didn't have SMN2,
you'd
that's
be dead.
Yeah, exactly.
Right.
So that was my argument on the phone when I was trying to get people through the policy here, but it involved needing to do some extra genetic testing for some of our patients just to prove that they had SMN2 to begin with. But there's no reason to say that somebody with 4 copies versus someone with 2 copies would or would not benefit from this medication. It's clear that it benefits everybody that's treated with SMA.
Work in progress.
It's a great example of we don't know what we don't know, and that's where the better communication between
How much does the drug cost?
Year one, $750,000.
Year one?
Year one, and that's because of the loading dose.
Okay, thereafter?
As described. After that, it's a little under $500,000.
So, $750,000 in year one, $500,000 per year thereafter.
And that's just the medication,
That's
let
just
alone
the medication.
how complicated this is to get to some of our patients, because it's an intrathecal delivery in patients who have scoliosis and respiratory involvement, and all the, you mentioned anesthetists are scared of this disease.
Yeah, you're going to have to give them
procedural
something,
support,
sedating them.
Yeah, it's a challenge to logistically deliver as well.
It's tremendous expense, and as I understand it, correct me if I'm wrong, the object is to make people not only live better, but live longer. So the better this drug works, the longer they get it at $500,000 a year. This is an expense which is it's real.
Well, it's real, and hopefully it is doing something. Hopefully it is improving, has capacity to benefit, improving quality of life as well as survival.